I thank the gentleman. I wanted to respond, Mr. Chair, if I could, to some comments made from my friend from California, who I know cares a great deal about those with persons with disabilities, those with mental illness, and those with substance abuse. This is more of a message for the people of America that I want them to understand. This committee worked very hard, and I was never more proud than what this committee did in passing unanimously the Helping Families with Mental Health Crisis Act, which then went to the floor and passed 422-2. That powerful bill provided a lot of services in the mental health arena, strengthened parity laws, authorized a number of programs. And I want to make it very clear that this bill does not change any of that law. This is some of this committee's greatest work, probably its greatest bill in the last session, as it was combined into the 21st Century Cures Act.
Gentleman, yield.
And not yet. And I want people to know that. The second thing is that the essential health benefit remains in through the Affordable Care Act. It is not struck at all in this bill. Further, there is other language in this bill which allows grants to go to the states out of the $15 billion grant pool in the first year and the second year, and then $10 billion out of that to maintain and to strengthen mental health and substance abuse services. So I want everybody to know that those are going to continue to be part of this as we move forward. I also know in the future we're going to continue to work on reforming some of the mental health systems in America that under Medicaid, many states do not collect data on what happens to their folks in Medicaid. This bill actually requires them to collect data because what they can't, they don't even know what they don't know, and what you don't measure you cannot manage. So this will help. As we know, persons with mental illness oftentimes have chronic illness, primarily heart disease, diabetes, lung disease, infectious disease. But as you track those and as you better wrap services around them, you actually lower healthcare costs, something we'll get in the future. But by the essential health benefit maintenance in this, by further grants, by parity, and by other elements of this bill, it does not undermine past issues with this. Mr. Kennedy, you wanted me to yield to you for a moment?